Thank you, Chair. And thank you all for appearing before the committee today. I think your experience and insights as service providers is essential in understanding how we improve disability supports, especially in the case where the majority of disability services are provided on behalf of the state by the voluntary sector. My first question is for the National Federation of Voluntary Service Providers, but Chair, if I have more time afterwards, I have more questions, if that's okay. So first, the National Federation of Voluntary Service Providers, I welcome your acknowledgement of the unmet needs of children's services and the very urgent need for multi-annual investment. I raised those issues last week with the HSE and the Minister for Disability because the Progressing Disability Services Programme is currently failing, due to a lack of staff and a lack of resources. And using my own constituency as an example, but I'm sure it's the case in many constituencies, we have really worryingly long waiting lists for assessments, not to mind incredibly poor access to therapies. People, after assessment, maybe a year and a half later, only having received an hour or two of those essential therapies. So you're at the front line of a situation, I suppose, where you're caught between inadequate government funding and the needs of children and young people that you're working with. And you referenced the department's capacity review there. So I think that says it all. The department assessed that its own review said that we needed 350 million to meet the unmet needs of people with disabilities. And then there was an additional 65 million allocated. So of course, it hasn't come anywhere close. So from your experience, can you outline what needs to be done to address the issues in that particular area? And like I said, Chair, if there's time, I have more questions.
Thank you. I might address that if it's okay, Chairman. In respect of the children's services, Deputy Cairns, there are probably two things that we would say. First of all, the Progressing Disability Services model is being implemented around the country. Parts of the country was implemented several years ago. Parts of it's actually just this year that the transition is taking place. It does represent a huge upheaval of services. There are teams being merged together, people moving from one team to another. And it's fair to say that immediately after that transition or during it, that the teams are probably not at their maximum productivity. And we would advocate that completing the transition as quickly as possible and getting those teams functioning and firing on all cylinders, I think is really important. I think we would notice that parts of the country that may be reconfigured back as far as 2013 are running better than teams that are in the midst of the reconfiguration. So getting that reconfiguration completed as quickly as possible and running is important. The other aspect, and it's unavoidable, is resourcing. There were waiting lists before the new children's model PDS came into place, and they remain afterwards. There are, I think, something like over 90 CDNTs, Child Development Network teams around the country. There's a significant disparity of resourcing among teams. There will be teams who have good ratios of staff to people that are children that are supported, but there are other networks where the resourcing is a long way down, and we would absolutely advocate for a multi-annual programme of funding, particularly bringing the resourcing of the CDNTs up to levels that are necessary to meet the needs, to get timely issuing of initial assessments, the family support plans, and the timely interventions.
Okay, thank you. And Natalia, do you want to come in there?
Yeah, thank you, and thank you, Deputy Kearns. Just to come in and again to talk about the Progressing Children's Disability, many networks, it's only since October that they've reconfigured, and that's that move from the unidisciplinary to the interdisciplinary model, and it's where really it's that family-centred practice. So there has been huge progress, and I would acknowledge and working with other lead agencies and with the HSE around that, and it's that equity of access as well for children. What that has resulted in, though, and from the mapping exercise, there are some networks that have increased from maybe 900 children up to what they thought might be 1,300 children, and now might be 1,800 children. So that exercise is ongoing at the moment to look to see what resources are needed. Significant funding was received, and of late another 100 therapists from government, and funding came down from that. A lot of that is at basic therapy level, and I think one of the things we need to look at going forward is the conversion from some basic to therapy grades. And also, because a lot of the networks reconfigured at the same time, there's huge recruitment gaps. We're going out to the market, we're looking for the same individuals. And it was useful to see in one of the government's action plans that collaboration approach with third level, because over the coming years, we will need further training courses for therapists. And if you look at, I think there's between now and 2032, I think there's 54 million identified for children's services, and a lot of that is with frontline services. So there is a lot of work that has been done, but in order to ensure that we get people off the waiting lists, that we're looking at that intervention and key intervention and early intervention, it is working, looking at therapists and building up their skills and specialist skills as well across the areas.
Okay. Sorry. Niall, do you want to come in there? No. Okay. You want to come back in, Holly?
Yeah, if that's okay. And yeah, I appreciate the responses, and I suppose I understand that the reconfiguration is so important. But like Michael referenced, when the allocation of staff for that reconfiguration is potentially I know in one very populated area, there's 0.5 of a nurse or 0.5 of physio allocated. I suppose the concern is that even when those reconfigurations happen without the funding, say that the department decided that it needed, that people are worried they will still be on these waiting lists, and even when they finally get assessed, sometimes not then getting the service that they need. But I suppose we as a committee as well will keep pushing for the adequate funding to be allocated, because I think we do understand that the pressure that puts on those network teams then trying to provide a service and just actually not having the resources available. But another thing you note was that there are 4 supports that respect and enable individuals' independence, such as personal assistance and supported independent living. And I heard somebody referenced the kind of geographical lottery sometimes with respect to this, and I know it really does depend what part of the country and whether or not you can access independent supported living seems to be a really tricky one. And it was highlighted just in recent weeks, and to be honest, throughout the last year by several witnesses who come before the committee. So I was just wondering if you could elaborate on how we could push a system in place that can guarantee independence in line with Article 19 of the UN CRPD. And then, so there was another question for the National Federation of Voluntary Service Providers, and then a question for the Neurological Alliance of Ireland. You highlighted the current shortage of services for neurological conditions and the increasing numbers of people affected by those conditions. I just wonder if you could elaborate for the committee the impact of the lack of rehabilitation and support on individuals, especially in terms of employment and education.
Okay. Alison, you're muted.
Sorry, thank you for your question, Deputy Kearns. The National Federation, as an umbrella body of service providers, has been looking at this question of independent supported living. We're required for quite a number of years, and we developed a community of practice, which was a shared learning space for organisations, with more than 26 organisations collaborating to look at how do you develop individualised supports into the future, and where it was possible to do so. And there's been lots of kind of different areas of support where Genio have brought in grants. There's been the Service Reform Fund. There's been little initiatives that have happened that have allowed us to explore and put in place those options for a range of people, and to learn together and share learning with the person with the lived experience, sharing their experience of what it's like to change from. I mean, we've had people who've described what it was like to live in congregated settings, move into independent living, and have their lives transformed. And it's from those people who've shared their experience that we learn the most, with their families, with the people who support them at the front line, and right to the management and the way that you develop that. And so we've learned that the outcomes from that next steps shared learning are that it is absolutely possible to provide independent supported living for people of all ranges of needs and support requirements. But what is required, and it's probably going to be the theme of today, is that multi-annual investment programme. So at the moment, if we continue to only be able to respond to the crisis and the emergency, that's typically going to be done very expensively, without the kinds of outcomes that we're talking about, where somebody gets to choose the kind of support, the kind of life that they need. Do they wish to live alone? Do they wish to live with some other people? Do they wish to live in student accommodation as a third level student? Do they wish to have employment and live near their employment? All of those things are not possible if you're responding in a crisis. So we've proven that in Ireland, it is absolutely possible to provide the supports and for people to have wonderful outcomes in their life, to experience independence in a way that they haven't. And that's people of all kinds of ability and needs. So we know that it can work, and with the correct investment, it will work. So it's really about developing at the different stages and levels that people need. So some people do have complex medical requirements that will require nursing support. Other people require a couple of hours support, somebody to look in, ensure that maybe they're getting a bit of a hand with their groceries or their cooking. And we shouldn't be providing the top level of support unless that's required, because it'll just impact on people's independence. But what we need to be able to do that is have multi-annual funding that allows us to develop those options at the right time in a person's life, responding to their will and preference. And I suppose at the other side of the coin is that as adults without disabilities, people have the choice to move out of their family home of origin at a particular time in their life when that's right for them, and their families have the opportunity to plan for a future. But there are many carers, family carers, who are living into their 70s and 80s, who haven't had the opportunity of planning and visibility into the future for their loved one. And that's not right for the person who is supported, who may wish to live independently. It's not good for the health and well-being of the elderly carers. So I think the acknowledgement in the disability capacity review of those kind of cohorts of people has been very welcome, and what we really need to do now, and apologies that the same answer may be coming for a lot of the questions, is we have to get the multi-annual investment programme to allow us to implement those things.
Niall or Mags on the neurological. Niall, do you want to come in? You're muted.
I think I see my colleague Mag with her hand up there, so I'll defer to Mags first if she has an answer there.
Okay.
Niall, I might get you to reply to Deputy Kieran's question in relation to the impact, because I know it's something that you're seeing every day. I just wanted to say, just picking up on her points in relation to the vocational and the education supports for neurodisability. One thing I want to stress to the committee this morning is that the Neurorehabilitation Strategy, it's not just about beds or medical teams. It's about the full range and gamut of supports that people living with a neurodisability in Ireland need. So it's not just about hospital beds, it's about the full range of supports to live well with these conditions. And, I know we've talked a lot about progressing children's disability services this morning. If I can emphasise that for adults living with a neurodisability in Ireland, the Neurorehabilitation Strategy is as critical as the progressing disability services to children. And the fact that it isn't meeting, the fact that it's not progressing, is really leaving these people behind. So I'll ask Niall to describe that, about the impact and how these people are being left behind because of the lack of implementation.
Niall.